Thanks, Dan. We're practicing social distancing here. For those who can see us on the video, thank you for joining us. Today we had 11 new cases, presumptive positive cases of COVID-19 reported to us. This is the first time we've seen any evidence of community transmission, a situation where we've had no history of exposure to someone who's traveled or has traveled into an area where COVID-19 is significant. 2 of the 11 cases today had no travel history and were not cases where we'd expect them to be in contact with people who traveled, suggesting that we now have COVID-19 circulating, at least to some extent, in our community. The good news from today is that we have done another series of tests as part of our Sentinel sampling survey. And of the 61 new samples, we still have yet to find any positive samples. Altogether, we have 185 samples of people selected randomly around the state, and we're not finding any illness among any of those individuals. 0 out of 185 were positive. So if the disease is being transmitted in our communities, it's probably not widespread at this time. But this is a time to take everything we've been saying very seriously. We were talking about community spread for a long time. It's beginning, it's starting, and we need to be sure that we're following all the instructions that we have put out. You need to maintain social distancing. You need to be sure that you're following the directions that we're providing on hand washing and avoiding large crowds, and all the other things that we're saying everyone should be doing. It's not just that it might happen, it is happening now. So time to step up and take what we're recommending seriously. We are in the process of discussing with the governor's office and others additional measures that could be taken to assure that we're doing everything we can to prevent the spread of COVID-19 in our state. And this includes both restricting travel to Hawaii, as well as being sure that if it gets here, we're doing what we can to prevent it being circulated. I'm going to ask Dr. Park to discuss the current cases that we're looking at as much as we can, tell you about those cases. Again, let me emphasize one thing. These are just reported today. We're still investigating all these cases. We don't know a lot about the exposures that may have occurred, so please keep that in mind. We want to share with you what we know, when we know it, and not to delay on that. Again, we'll share what we do know. Sarah?
Yeah, so our focus continues to be on investigating these cases to protect our community, to make sure we have relevant information to guide our efforts, our recommendations to our governor and to other leadership regarding appropriate mitigation measures, protection, as well as public health guidance. And so at this point, I would say that even as we do not have full information on cases, we are going to continue to provide the relevant information to protect our community and so that you may be informed. So as far as the new cases is concerned, as Dr. Anderson has said, we know that 2 individuals out of the 11 do not have any travel associated with them. They either did not travel or did not have any association with anyone who has traveled, as far as we are aware at this time. So it does suggest that we have at most, or at least, I should say at least, localized community transmission. These 2 persons are not associated with each other and are on the island of Oahu. So we know at this time, and quite frankly, I'm not surprised because of the fact that we have our population is so dense here. This is the highest risk area, frankly. Remember, this is person-to-person respiratory droplet transmission. The closer people are together, the higher the risk, and so we do need to keep in mind the social distancing measures that we have been recommending. So again, these two persons are on Oahu. The others have traveled. There are a couple family units among them and among the others. And there is 1 child among the new cases. And I think that really is the relevance here, is to just, and what I would take away from that is to understand that although the vulnerable population remains the older individuals and those with underlying illness, it's a reminder that anyone can be infected. So again, social distancing and of course hand washing, all the appropriate hygiene measures that we've been recommending are important.
Let me say a word about testing, because I think there's a lot of issues and concerns about testing today. The department's ability and the community's ability to be tested has improved dramatically since the private labs have come online. At this point in time, essentially anyone who has symptoms can go to a physician, and if the physician feels it is it appropriate, can be tested for COVID-19. There are 3 private labs that are either testing now or planning to test in the very near future. These 11 results we got today were all from our private laboratories testing system, and today we've collected well over 1,000 samples from those laboratories, and we are now finding illnesses associated with people who are not as seriously ill as some of the previous cases that we've talked about. We're much better able now to determine the prevalence of the disease in our community. It's very possible in the past some individuals were falling through the cracks and we weren't identifying them because they didn't have serious illness. At this point in time, though, I'm confident that we have the capability of doing tests on everyone who the physicians feel should be tested. Having said that, we need to be judicious about how we use our supplies. We don't want to be out there testing people who are asymptomatic. It's a waste of everyone's time. The individuals who are tested need to be symptomatic if we expect them to be positive. Otherwise, it's a waste of resources that are precious. Already there's been a shortage of some supplies in some areas. Across the country and across the world, people are finding shortages in personal protective equipment, in ventilators, and lots of other medical supplies that are going to be desperately needed in months to come. We assume this problem is going to get a lot worse before it gets better, and we do need to be sure that we're using the resources we have wisely.
Let's take our first question. Thank you, Dr. Anderson and Dr. Park. Our first question from KHON2, please.
Dr. Anderson, what is your position right now on all visitors for a 14-day quarantine?
We've been discussing with the governor's office a number of options as it relates to preventing visitors who are inadvertently to Hawaii and spreading the disease. This includes not only visitors, by the way, but also returning residents. Keep in mind that many of the cases we've seen are returning residents who have been to places like Las Vegas or New York or Florida or other places where the disease is far more widespread than it is here. So we are of course concerned about those people who may bring the virus to our shores. Other countries, including New Zealand and South Korea, have imposed a 14-day quarantine for all returning individuals, both visitors and residents. And under the circumstances, that seems to be a wise move on their part. We have situations here that are different than theirs, but I know that option is being seriously considered by our governor, along with lots of other measures that may be appropriate and necessary in the future.
Okay, our second question from Big Island Now.
Bruce, I'm just curious, have you recommended a mandatory lockdown to the governor, and is that being considered? I mean of everyone.
Yeah, similar to what's happening in the Bay Area, I presume.
Illinois, New York, California. Yes.
Yeah. The areas where they've had lockdowns are typically areas where they've had widespread community involvement. The question I would ask would be, how long are you going to be locking people down? One thing I think we've all come to realize watching what's happening around the world is this is not a 2 or 3 week situation. We're talking about months, and a lockdown would imply that it's going to be temporary and it's going to be ending, and then we can let everyone out of the shelter, if you will. That is not a scenario that we think is likely here. We're talking about several months at least, and probably longer, before we see a situation where there is a decrease in the number of cases and where we can relax a bit on our controls. Having said that, I do not believe that a lockdown as is occurring in some of these areas is appropriate at this time. Nevertheless, I think we need to be taking strong actions to prevent person-to-person spread, effectively the same as if we were locking down. I think a lot's going to depend on how seriously people take this situation. If people continue to go to the beach and get together as they have been, we have no choice but to impose more stringent and draconian measures such as that. And hopefully we won't get to that point. But if we can't control gatherings and if restaurants aren't going to be closing and other things happening to prevent us from achieving our social distancing, then we will have no choice but to go down that road. I think the next few days is going to be critical in our determining whether or not what the governor has mandated and others have mandated, including the mayors, are going to be effective. And then I think we're going to have to make decisions on whether that's appropriate here.
The Maui News, please.
Oh, hi, Doctor. Wondering if you folks have more information on, I don't know if there are a couple or not, of those who just recently tested positive after either coming back from Europe or I don't know where they tested positive from.
We have had a few people coming back from Europe, so unfortunately I can't divulge more information as it is on cases. I can say that we've made contact with just about all the cases, actually all the cases by now, and are, as I mentioned earlier, continuing to investigate. Primarily our concerns are protecting our community and making sure that any persons who may have had especially prolonged close contact with individuals who are confirmed are advised appropriately and also are monitored by us if they need to be. So that's the extent that I can even really discuss, even if I knew which couple to which you were referring to. For those people who are confirmed, hopefully, and actually for those people who are tested at all, whether it's through the clinical labs or through our state laboratories, please keep in mind that you're being tested because you're sick, and we are recommending social distancing. We are recommending that if you are sick, please stay at home, keep your distance from others while you wait for your result. So, again, social distancing is really, really important, and keeping our germs to ourselves is really important.
Civil B, please.
You said civil beat? Hi, sorry about the delay. My question is, I'm wondering if you guys will give us sort of an expectation of the number of people you expect to be infected here in the next 2 months, 6 months, 8 months.
I would hope it would be zero, but I feel like you're a question that I get asked a lot when it's flu season, and I guess then from that you would gather that it would be impossible to predict. The hope is that the mitigation measures that are being put in place now and will be put in place will help slow things down and prevent essentially what we're seeing in other jurisdictions. And again, just a reminder that as long as we as a community practice social distancing, keep our distance from others, and especially stay home when we're sick, I think we may get out of this ahead. But again, it's a matter of all of us doing our part together.
Let me add a little bit. This is Bruce. All our best experience is actually looking at other places where COVID-19 has become community spread, and in situations where widespread community transmission is occurring, you see an almost exponential increase in the number of cases. Usually that's in places where they haven't implemented some of the measures that we've taken here. I think we're in reasonably good shape from that standpoint. I think there are things that were done here that haven't been done in other places before they've started to see community spread. But I would anticipate that now that we've seen some community spread, it is going to continue to be a problem and continue to be occurring in increasing frequency as we go forward. Let me say, up till now, we've seen 1 or 2 or 3 cases per day. Yesterday we saw 10. Today we saw 11. I would expect we're going to see more and more, at least for the near
I
future.
think we have some time yet. So again, if everyone can practice that social distancing and all the other measures, sort of infection prevention that we've been talking about, I think we have a chance to potentially get out of this. And actually, if we are successful, I think the community will wonder why such draconian measures are continuing to be enforced upon them. And honestly, I envision that we would have trouble keeping people in those sort of enforcement, in those, complying with those measures. But that's the kind of situation we hope we'll be in.
One confounding factor that I have to throw out there is we've seen 10 yesterday, 11 today. The extent of private laboratory testing has increased dramatically over the last few days. So whereas we were previously able to test a few dozen people, we're now able to test thousands of people, and that
makes a difference.
That makes a difference. We would I would expect to see more cases as we've done a lot more testing now than we have been able to do in the past. So the increase may be in part attributable to the increased number of testing we're doing. It may also be because things are changing and we're actually seeing more cases than we've seen here. I think it may be a combination of both.
Hawaii Public Radio.
Hi, thanks so much. We keep hearing about reports on there being a very low supply of PPE and needing to conserve that supply. Can you put in perspective what exactly that means in Hawaii? Like, is there any way to quantify like how long we have until we run out, or is that even a possibility? Some kind of gauge into what that means. Also, somebody's thing not muted. It keeps someone keeps clearing their throat, and it's like kind of messing with their audio. Sorry.
Honestly, I hope whoever's clearing their throat is just practicing social distancing and they're not sick. So, at any rate, so PPEs. It's actually not a really easy thing to really truly quantify down to the last day or the last week, but I will say that a couple of the hospitals and facilities have commented that they're grateful. The Strategic National Stockpile, some allotment will be made available to states because it will be very sorely needed, because at the current burn rate, what we call the burn rate, so the current use of the PPEs for care of patients, and keep in mind that we use those same PPEs, masks, gloves, eye protection, not just for COVID-19 infected patients, but also for patients infected with other respiratory pathogens or for other conditions, immunocompromised persons, to protect them from all of us, from regular issues. So we're having to use those PPEs for all those things, and at their current burn rate in a couple of the hospitals, they say they could be out within the next couple of weeks. So some of them say they're good for the next month. That's not really a great sort of a situation we want to be in, obviously, because when we're talking about, pandemic, we're looking at months of this. So we really need to think about conserving our PPE supply, masks, gloves, gowns, eye protection. Those are really very important.
We in Hawaii are actually better off than most places. That we have caches of supplies put aside for this day, for days like today where we may need them. The Hawaii Hospital Association is been organizing this program where in strategic locations associated with most of our major medical centers, we have equipment and materials put away that include protective equipment, eye protection, and other supplies that are essential for responding to infectious diseases. That's the supply we can draw on immediately, but even after we do that, if we can't find replacements, we're going to be needing to bring in additional materials and equipment to be able to deal with the problem that many other states are now struggling with, where they have few hospital beds available and the equipment, respirators and so forth, are very hard pressed. Many hospitals are canceling elective surgeries in order to preserve equipment and supplies for COVID-19 cases. That's true in New York and in other states where the disease is much way ahead of where we are now, but we could get there very quickly. And of course our efforts are being focused on identifying where we can get additional supplies now to augment the the resources that we have available to us today.
Okay. Star advertiser.
Sorry, that was me clearing my throat. I apologize. So we've taken photos of tons of people at Waikiki Beach and those hiking at Coco Head. They've not been 6 feet apart, and that was just like a few days ago. Should we assume that we're all carriers and keep distance from grandparents and others? I mean, what do people assume, that we're all potential carriers at this point?
It's not a matter of assuming you're all carriers. It's trying to make this a regular practice, you know, especially in Hawaii, where we tend to come together very close, we hug each other. It might be a little bit more difficult for us to keep this in mind. And so it's really trying to make it second nature as part of our social practice to keep distance. Because when you do not have symptoms, you're not infectious. But the thing is, we can't predict when you might start to feel ill. And so it's really taking that precaution to keep distance from each other so that you don't have to worry about, well, did that person know when they started to feel ill, or you yourself that, oh, I might just start to feel ill, but oh, it's probably nothing, and you keep associating with other people. So this is really to try and prevent that circumstance where you accidentally, you didn't mean to, you were in close proximity to other people. So really trying to encourage everyone to think about social distancing, keeping that distance. As far as hiking outdoors, being out on the beach, you know, those are actually good activities. Being outside in the wind, especially with our usual trade winds, when our usual trade winds are blowing, that's a good thing actually in terms of helping to prevent disease transmission. But again, you still need to keep that social distancing. So while, you know, I think Dr. Anderson and I would encourage people to exercise and be outdoors and such, keep your distance. I think I heard on one of the radio stations about a couple who was seen running along, and the one person was up on the sidewalk and the other one was in the street, and the person was like wondering, why are they apart? And they're like, oh, duh, they're practicing social distancing. So things like that, just thinking about, you know, simple things like that to keep us apart. Being able to, you know, still enjoy life and things about life. I mean, staying cooped up indoors is a difficult thing to do. So being active, but doing it in a mindful way to protect ourselves as well as our community.
Let me say also that, you know, we haven't experienced beach closures and other actions that have been taken in other jurisdictions where COVID-19's been a problem. If and when we continue to have problems like this, and in Waikiki Beach, for example, we're still hearing about people gathering and enjoying the beach as they always do, and not maintaining that social distancing, we may need to take some additional actions. And again, we've been talking with the governor's office about additional steps that may be necessary to assure that social distancing. One thing that needs to be emphasized, and you can't overemphasize, is if people are sick, they should stay home. They should not be out exercising and potentially exposing other people. But otherwise, we all need to maintain our health. We're in this for the long run, and being healthy is going to be, I think, important to build the resilience we need as a community to fight off this disease. I want to say, and I won't compromise any other questions. I want to say a little bit about mental health too, because I think that's an important consideration for all of us. You know, we go home and we watch TV and we see story after story about COVID-19, and honestly, for many of us, it becomes very depressing and causes a lot of anxiety. I would strongly recommend that people not dwell on what's happening everywhere, and take a few breaths, stretch, get some exercise, and meditate. Take care of yourself. You need to eat well-balanced food. So far, there's no problem with getting food. People panic about it, but the food supply is not compromised here. We should have fresh vegetables and other good, healthy foods. Make sure you're eating those and keeping your body healthy. You need to talk to others. And honestly, talking about your concerns and anxiety you have is always helpful, and something we'd encourage. Share your feelings and experiences. I think this helps a lot for everyone. And also recognize that feeling stress and anxiety in this type of situation is only natural. It's not you. I think everyone here feels that. And again, I wouldn't hesitate to share it with friends, loved ones, and others. They may be feeling relieved to be able to talk about it too. So take care of yourselves and keep yourself healthy.
Hawaii News Now.
Hey, Bruce, a little earlier you said that, at least as far as the general public, testing people who are asymptomatic would be wasting resources. Now, were people without symptoms given COVID tests at the state capitol yesterday after Senator Nishimura tested positive? And is that a new standard for all potential cases of contact like that, or was this a special case for some reason because the capitol is kind of a closed system, I guess?
Yeah, I went down there and I actually saw the lines lining up and talked to the physician who was doing some of the counseling and sample collection. And he assured me that he was only testing people who were symptomatic, but he was also getting histories on all those others who were coming through, so that if they became ill, he would be able to then expedite the sampling. That is not typically what's done, but in this case they did take the initiative to set up a screening program that I think is under the circumstances appropriate and necessary. Again, I would have supported a program like this wherever we had a potential cluster of cases. Certainly people needed to know what to do if they became ill, and it was an opportunity to talk to them about where they should go if the symptoms developed. We, of course, are following up on the close contacts, and that will continue. And maybe, Dr. Park, you could talk a little bit about where we are on that investigation. And
yeah, so we are working with both the House and the Senate to identify those individuals who had specifically prolonged close contact with the individual, because obviously those are the people at highest risk, or at even medium risk. Actually, the people at highest risk to any individual who is confirmed positive would be the household. Because if you think about it, those household members are always in that close, intimate contact with the person. Those are the highest risk. The next risk are those people who may have had some prolonged. Should I stop and wait?
We're getting some interference here. Someone put themselves on mute, and we'll pick up in a minute.
I hear someone talking about Haima.
Yeah, please mute your phone.
Email to yourself.
Hello, can you please mute yourself? Hello?
Whoever's talking about emails. Okay, where was I? Oh no.
Okay, I heard a click. We're probably okay. Sarah, I think you're going to have to go back and talk a little again about how you're handling close contacts and so forth.
So a reminder about who is at risk when we're investigating. What we're really always focusing in on is who are the really true close contacts of individuals. So the highest risk to any person who is confirmed as positive for COVID-19 would be those members in the household. The next risk might be those who have prolonged contact, are not household members, do not have that intimate contact. So, for example, someone who maybe had a conversation, face to face with someone for about 30 minutes or so, that might be what we would categorize as medium risk. And so these are the types of things as examples of what we're looking for when we investigate, and we're working with the House and the Senate very closely regarding this person's close contacts to ensure that all persons who need to be advised are advised appropriately, that they're monitored appropriately, and if there are ill persons who have symptoms consistent with what we would expect for COVID-19 are tested appropriately.
KITV?
Yes, sorry, I had to be very careful to not hang up on you again. Director Anderson, you've referenced a couple of times the extra actions that you may take if people are not keeping their social distance. You just mentioned it a couple of minutes ago when addressing all the people bunched up together outside. If people continue to go to the beach and get together, we have no choice but to impose more stringent measures. Would you mind elaborating what you think those measures might be? Can you hear me?
Yes, I can hear you. Well, I'll give you an example. If for example, Waikiki Beach continues to be an area where people congregate and are not able to practice social distancing, actions to close Waikiki Beach would be appropriate. I think it's going to be incumbent on the beachgoers and the property owners in the area to assure that doesn't happen. If it does, the state does have the authority to close beaches and will do so. That applies to many public areas. The city and county has taken, I think, very bold action to restrict and limit the opportunity for group meetings and other potential problems by closing public parks. Normally I would say that's overkill, and we shouldn't be eliminating the opportunity for people to go jogging or to exercise if they can maintain social distancing. But I think in this situation they considered the picnics and other things that might happen in the parks, and the fact that the restrooms would be closed, and making that decision. We don't want to go there if we can help it. I think it's good to have people have the opportunity to get out, walk their dog, to go hiking, swimming, fishing, surfing, doing the things they normally would do. But we certainly don't want people to be exposing themselves to others or have them exposed to individuals who may be ill. So I think we're going to have to take this on a case-by-case basis and see what the community's reaction is, in part after they hear that this is beginning to be community spread. I mean, this is a time to ramp it up. It's starting, and we need to be sure that we take this situation very seriously and practice the social distancing, stay at home when you're sick, and all the other things that we've been preaching for a long time.
Okay, MauiNow.com.
Sorry, somebody is continuing to talk on the line. Somebody else.
Yeah, if everyone could check and be sure you're
Stop
muted
that.
on your phone with *6, please.
We're gonna.
Hear you, so. Okay, Wendy, clear. Go ahead. MauiNow.com.
Wendy, you better hit *6 now. You can talk.
Hi. With the majority of cases being visitor impacts, there's some concern in the visitor industry of people working at the hotels about their employer not implementing that safe distancing. Who do they contact? Who do they communicate with to make sure that their employer is following the guidelines as well?
Well, I think many of the employers have actually taken very positive actions in that regard. If someone is being recalcitrant or insensitive to the issues, I would suggest that they contact someone at the health department and we can follow up. I don't want to get dozens of calls from different people. Obviously, I would hope that they would talk to their employer about the situation and urge that they take action to implement the social distancing that is necessary before they call anyone. That's only reasonable. But having said that, if they find a situation is not being addressed adequately, that would be a possibility, and of course we would follow up. Let me say again, as far as I know, most businesses here have been very positive about what we're doing. They've actually urged that we do even more than what we're doing in some cases, and I think everyone understands the situation we're in right now and does take this very seriously.
BigIslandVideoNews.com.
Dan, I'm okay, so good. Just give me.
Okay, Dave. Next would be Hawaii Tribune Herald. Michael?
Yes, hi. Back up to the part about the 14-day quarantine for visitors. You said that that's a possibility that you're considering. How feasible is that to make that mandatory for every visitor to the state when we still have thousands of people coming in every day, as far as I know? What would the infrastructure needs be for that? I mean, getting transport for all these people to get quarantined.
Well, to be effective, you of course have to have it apply to everyone, both the visitors as well as returning residents, and that's what's being considered. You would not want to try to be selective on who at this point who you would let come back to the state. Everyone's potentially at the same amount of risk if they've been in places where there may be virus, including residents as well as visitors. So first of all, it would need to apply to everyone. In a situation like this, you would need to, of course, be able to document who's coming into the state. You'd need a name, address, a location where that individual would be staying, whether it's at their residence or at a hotel or some other lodging. And you'd probably need contact information, be able to check in on the individual or have them check with you to make sure that they were, in fact, honoring the conditions of the self-quarantine that was imposed. All those conditions would have to be in place to make this work. Those are basically the conditions that have been imposed on residents and visitors in South Korea, New Zealand, and in other places where they've implemented similar measures.